Anterior posterior is the superior position of defibrillator pads in cardiac arrest. I mean, not really. I mean, it kind of is. It is, but not so much. It really just comes down to what your goals are. So historically, there has been no quality data that has demonstrated superiority when comparing pad position between anterior lateral and anterior posterior. So the recommendation has been to place the pads in the anterior lateral position so that you don't have to reposition the patient. You can focus on high quality CPR and faster time to defibrillation. But there are still some things that make the anterior-posterior position worth considering. First of all, it's understood that impedance is generally lower with the anterior-posterior position, and that's because of the pressure that is created from the patient laying on the pad. They call that an impedance sandwich. Also, the Defib trial, which looked at dual sequential defibrillation, also looked at vector change. So after 3 unsuccessful defibrillation attempts, they moved the pads from the anterior-lateral position to the anterior-posterior position, which resulted in more incidence of terminating ventricular fibrillation. But vector change did not result in increased rates of neurologically intact survival. And then we have the single-center prospective study that was published last year that looked at 255 patients who were broken into 2 cohorts. One cohort defibrillated in the anterior-posterior pad position, and the other cohort defibrillate with pads placed in the anterior-lateral position. Patients who were defibrillated in the anterior-posterior pad position had an almost 2.64-fold greater chance of ROSC. But those patients who made up that difference in ROSC, they didn't arrive at the hospital with a pulse, they weren't admitted to the hospital, they weren't discharged from the hospital, and they weren't discharged from the hospital with good neurologic recovery. So no matter what the position, right now we don't have any quality data that demonstrates more people are walking out of the hospital with a functioning brain. However, remember when I mentioned dual sequential defibrillation? Dual sequential defibrillation does result in higher rates of neurologically intact survival. So if you're in a position to perform this intervention, then it just makes good sense to start off with pad placement in the anterior-posterior position because it doesn't interfere with anything placing those pads in the anterior-lateral position prior to that intervention. Here's a caveat I want to close with. The Defib trial stopped early. The other study I referenced was a smaller study. If you still want to start off with the pads in the anterior-posterior position, that still may make good sense. Decreased impedance and increased ROSC isn't nothing. But if you're not accustomed to placing the pads in the anterior-posterior position, this could be a clumsy effort and it could interfere with immediate CPR and immediate defibrillation. So I wouldn't attempt this until you've trained your way out of that deficit. Links to the papers in my bio.